Good afternoon to all, and welcome to the COVID-19 update press conference here at the Office of the Prime Minister. Most Honourable Prime Minister, Minister, colleagues, members of the media, members of the public, good afternoon. This is a joint press statement. I'm very pleased to provide the health update. The Bahamas has recorded 14 new cases of COVID-19 in the last 24 hours. Regrettably, there has been 2 additional deaths confirmed. This brings the total number of COVID-19 related deaths to 46. This increase in the number of deaths includes all deaths currently under investigation. The country now has a total of 1798 confirmed cases of COVID-19. 69 confirmed cases reported on Sunday. Of the total number of cases, 1029 have been confirmed on New Providence, 523 on Grand Bahama, 66 on Abaco, 50 on Bimini, 15 on the Berry Islands, 8 on Cat Island, 19 on Exuma, 8 on Inagua, 5 on Eleuthera, 4 on Acklands, 1 on Andros, 2 on Crooked Island, and for 68 cases, the specific locations are still pending, and we are waiting island designation for these lab results. Long Island, San Salvador, Rumkey have not reported cases of COVID-19 to date. You would note that there is a decrease in the number of confirmed cases reflected in today's dashboard. This is due to the removal of duplicate cases and improved data management. To date, 634 recovered cases and 115 active cases. There are 90 cases currently in hospital. Could we go advance the slide, please? A total of 56 individuals have tested positive for COVID-19 at the Sandilands Rehabilitation Center in New Providence. Of that number, 29 are symptomatic and 5 are receiving hospital care. This slide represents the distribution of the hospitalized cases and patients by institution. Health officials are implementing a national strategy to increase the hospital bed capacity. With regard to testing, could you go back to, yes, to the dashboard? There are 1,100, there's a disparity with the number of tests to date. You would see that of the tests, there are 10,170 completed tests in the island. These tests are from the National Reference Laboratory, from Doctors Hospital, from Princess Margaret Lab, and a few other private labs. When one looks at the number of hospitalized cases, the number of recovered cases, and the number of active cases, we go to the quarantine slide, where there are 1089 contacts in quarantine. 937 have been discharged, and 939 are in isolation. As the ministry has reported previously, during the second wave of COVID-19, the National Reference Laboratory has experienced a significant backlog of cases. This is due to the sharp increase in the number of samples to be tested. This strained the resources and testing capacity in the lab. In the second wave, the number of tests have increased significantly to more than 300 samples daily. It is of note that the specimens from swabs are processed by manual extraction of the genetic material for each sample. Correspondent data on surveillance and lab results must undergo quality checks before those results are released to the surveillance unit for further notification. An early task was to address the backlog. Many qualified volunteers were recruited to assist with sample processing and data entry. Additional equipment was secured, and a total of 220 backlog samples were outsourced to the doctor's hospital lab for testing. Additionally, testing priority protocols were used to redirect testing from acute care facilities to the newly installed equipment at the Princess Margaret Microbiology Lab, where they are doing RT-PCR testing. The remaining backlog samples were processed at the National Reference Lab. Today, I am very pleased to report that the backlog at the National Reference Lab has been eliminated. Measures have also been put in place to prevent a backlog from recurring. The Ministry of Health has revised and communicated the COVID-19 testing policy and priority, also enforced the requirement to complete documentation of lab forms, and has recommitted to stricter adherence to case definition and testing protocols. Additional measures include digital data entry at the time of swabbing, timely identification of cases, timely identification of contacts, and increased testing capacity. COVID-19 testing is now being carried out, as you've heard, at the Princess Margaret Microbiology Lab, and will soon be possible at the South Beach Health Clinic Center on New Providence and at the lab on Grand Bahama. Turnaround times for results will be monitored. It is anticipated that the turnaround time will not exceed 36 hours. In order to best characterize the second wave of the pandemic, we have reviewed positive cases by specimen date of collection compared to when the results were received. I'd like to show that slide. Members of the public have asked for a specific breakdown or disaggregation of the number of backlog samples versus the new number of daily cases. When you look at the number of positive results by specimen collection date from July to August for Grand Bahama and New Providence, you get a better understanding of the number of new cases being reported on a daily basis and whether the number of new cases is decreasing, increasing, or stabilizing. And I'm hoping that we are able to show that slide, please. In this, could you advance the slides then? Because I wish to speak to the graph with the orange bars that represent specimens not reported in the weeks when they were taken. And the gray bars represent The gray bars represent the orange specimens that were analyzed in later weeks. Now, these data suggest that the number of cases is rising and indeed peaking earlier than what is seen with the gray bars. This data show that the delayed results from the backlog coincide with late results and lags in reporting. The team is working aggressively to address deficit in these data. Next slide, please. In Grand Bahama, we see in Grand Bahama the number of positive cases indicates a beginning flattening of the curve. In New Providence, we are seeing positive trends in the number of new cases. However, we remain concerned about the flattening of the curve, and we're evaluating our current hospital capacity. Next slide, please. In Abaco and Bimini, you see clear flattening of the curves there. I wish to provide you updates, including the location maps, GIS mapping of these cases. This is all Bahamas, by the way. And our next slide, please. We do have geomapping. We have so many people to thank for the data that we have. Can you advance the slides, please? Okay, that's Bimini. Again, that's Freeport and Grand Bahama. These are plots of cases. Next, please. This is New Providence. Thank you. When we look at the characteristics of this pandemic second wave, we look at the age and sex distribution of the cases, and we see almost an equal distribution between male and female. But I want to bring to your attention, in the 30 group, you see the highest number of cases, followed by the 40 group. Next slide. In the first wave, when you compare both side by side, you can see that shift in age distribution with the second wave that's in green. Now, we've spoken about testing, but it's only one of the strategies to help slow and control the spread of COVID-19. Contact tracing is a critical element when it comes to reducing the spread in our communities. During the first wave, a small health team of less than 10 individuals carried out this responsibility. In response to the second wave, 62 volunteers were recruited, 76 healthcare staff were reassigned to carry out contact tracing on New Providence and remotely with Grand Bahama and the Family Islands. To date, public health experts, individuals working out of the Contact Tracing Command Center at the Malia Hotel, have engaged and followed up with close to 4,000 contacts of confirmed cases. Next slide, please. It is, as we reflect on this pandemic, you see that it is largely in the Bahamian population. Next slide, please. When you look at exposure of the contacts, these are data we were able to get from our contact tracing. Exposures occurring between family members and in the workplace. your aqua, and your so-called mustard or yellow. It is noteworthy that once again, when we look at where this is occurring in the workplace, next slide, please, you see primarily the uniform branches, healthcare workers, trade, utility, and construction. They're the top of the list. Next slide. When we look at this phase of the pandemic, we see that it started in Grand Bahama. If we can introduce this slide, please, with animation, and you see where it has spread from Grand Bahama to the Abacos, to the Berry, to Bimini, New Providence. And then you see New Providence to Eleuthera, and then to Cat Island. Then you see from the Exumas. And then we look at New Providence in the red. That's really going in all directions. Next slide, please. There we go. When we compare the first and second wave and the modes of transmission, again, we have clusters. The red represents cases. And you see that each dot is a case. Next slide, please. This is the one contact in a Grand Bahama case. Had the blue, one case had the blue contacts. Next slide, please. The police force, each red represents a case and a blue a contact. Next. In New Providence Police Force, you can see how COVID spread in our uniform branches. Next. The Defense Force, and then lastly, our clusters at Sandilands Rehabilitation Center. The spread of COVID-19 in the Bahamas will continue to be dependent on behavior patterns of its residents and its compliance or adherence to the public health measures. One cannot stress enough how important it is to continue to practice our preventative measures in order to protect yourself and your loved ones. We cannot say it enough. When you go out, wear your mask, wash your hands thoroughly, and often keep a distance of at least 6 feet from others, and stay at home if you're not feeling well. The Ministry of Health has established workplace protocol guidelines, which you may access on bahamas.gov.bs. On the 17th of August, the ministry hosted a workplace readiness meeting for stakeholders. Workplaces are encouraged to complete the assessment and receive a score on the readiness of their workplaces. More than 800,000 people have died from this virus worldwide. We must stay disciplined, and we must keep following the public health guidelines. And if you do, we'll be able to slow and control the spread of COVID-19 and open up our economy. It gives me pleasure to introduce and welcome the Prime Minister, the Most Honorable Hubert Minnis. Good afternoon.
Thank you very much. Thank you very much, Dr. Dar Regis. And I want to congratulate you on an excellent presentation informing the Bahamas as to the exact data and all the graphs to show exactly what has been happening. And I especially want to thank you for the excellent job you've been doing in terms of guiding our contact tracing unit, taking control of that particular unit. Ladies and gentlemen of the press, I want to provide the country and the media with a number of updates on our comprehensive efforts to address the COVID-19 pandemic, which is in its second wave in the Bahamas. Let me begin by offering condolences to the family of Ms. Bernadette Rule, a registered nurse at the Sandlands Rehabilitation Center. Nurse Rule was COVID positive. As the Minister of Health previously said, we mourn the loss of a brave warrior from the front line in our fight against the pandemic COVID-19. The nation is grateful for our service and for all of those on the front line of this battle. Nurse Role was dedicated to our family, to our patients, and to the institutions of nursing and the Sandlands Rehabilitation Center. I once again offer condolences to the families, friends, and colleagues of those who have lost loved ones because of COVID-19. We continue to pray for all those who are in hospital, including the leader of the opposition, the Honorable Philip Brave Davis, Senator, the Honorable Michael Davil, and the Member of Parliament for Central and South Eleuthera, the Honorable Hank Johnson, who has been discharged from hospital and is now in quarantine. We pray for the recovery and healing of all who are COVID positive. I ended my own period of quarantine this morning, and I am so happy to finally see sunshine. I wish to report to the nation that I am COVID negative. Ladies and gentlemen, our plan and strategy from the very beginning of the pandemic was to utilize a range of public health tools to get the highly contagious COVID-19 virus under sufficient control in order to gradually reopen our economy and our society and to return to some level of growth and normalcy. In the past few weeks, we have been fighting our second wave of this global pandemic. Earlier today, a press statement was released with changes to the emergency orders for Grand Bahama and various family islands that take effect early tomorrow morning. This information was made available earlier today for the residents of those islands, the Bahamian public, the media, and the various island administrators. It was released so that residents of those islands can begin preparing for opening businesses tomorrow morning, as in the case of Grand Bahama, and to adjust the restrictions that regrettably have become necessary on some of our southern islands. These changes are available at the Office of the Prime Minister's website, opm.gov.bs. In the battle against this virus, your government uses a wide range of public health tools. Our public health team has preached their message for months: stay physically distant, wear mask when out, wash or sanitize your hands regularly, sanitize high-frequency touched areas. We release our COVID-19 dashboard daily. You have seen the large number of cases in New Providence the past few weeks. We put in place restrictive measures to slow the spread. These included curfews and days when certain types of shopping were not allowed. I made a lockdown order last Monday to reduce the spread of COVID-19 on New Providence. As your Prime Minister, my main responsibility is to protect Bahamian lives. That would never change. I take this responsibility seriously. The decision taken was based on data available and health professionals' recommendations at that time. I made the order with immediate effect. Right away, Bahamians contacted me and said they needed more time. We listened. The lockdown order was amended the next day to give New Providence residents the time they needed to prepare. This extended national emergency is the worst crisis in our history since independence. Like other countries, we are learning in real time what policies work and the ones that do not work. When we saw the early data on the number of cases here in New Providence, we were certain that there would be a need for additional restrictive measures. Over the last 24 hours, our health team and the University of the Bahamas further reviewed the latest data coming in, and that new analysis has shifted the recommendation. I am happy to tell you that the health team sees positive trends developing regarding the situation in New Providence. At this time, a hard lockdown is no longer recommended for New Providence. But I must say to you that if the data points to the need for other restrictions in the future to address community spread, such restrictions will be put in place. There is still no vaccine for this virus. The very latest data has led to the following recommendations by our health professionals and decisions of the government. To continue to slow the current spread of the virus on New Providence, the current provisions that are in place will remain in place until 5 a.m. Monday, the 31st of August, 2020. In order to give business owners time to put the necessary measures in place and to be able to properly plan your activities, please note that effective 5 a.m. Monday, the 31st of August, many businesses on New Providence will be able to resume normal activity with appropriate physical distance measures. For example, restaurants will be able to provide outdoor dining, curbside service, takeaway, and delivery service. Both Fish Fry and Porterski Dock will be permitted to offer curbside, takeaway, and delivery services. Construction activities and hardware stores will continue as usual. Other retailers will be permitted to offer curbside and delivery services. Offices and other businesses will be permitted to operate with physical distancing restrictions. Individuals will be permitted to exercise during the hours of 5 a.m. to 9 a.m. Beaches will also be opened between the hours of 5 a.m. and 9 a.m. daily. This list of businesses and social activities is not exhaustive. The full list of services and business detail will be listed in the revised order, which will be announced. We will continue to monitor and analyze the data during the course of the coming week. If the data points to it, we will announce the relaxation of some other measures. I repeat, for many businesses who may not be allowed to be opened before Monday, if the data is favorable and points in the direction, then the restrictions on those businesses can be relaxed and those businesses can be opened even sooner. We are committed to a measured phased reopening of the economy and society based on specific health metrics. It is hoped that this will aid the public to gauge when there may be more relaxed or more restrictive measures. Ladies and gentlemen, we are all living through the worst economic crisis in more than 70 years. I will give a major national address with emphasis on the economy in short order. We are working on a revised, detailed phased plan to boost jobs and economic growth domestically, even as we plan for the reopening of our vital tourism sector, which is dependent on conditions at home and abroad. Early in the pandemic, I established an economic recovery committee. And this committee is providing the government with advice and recommendations to position the country to emerge from this economic crisis as rapidly as possible. The Economic Recovery Committee will deliver its full report in September as planned. Even as the Economic Recovery Committee is working through its final report, it has provided to my office several interim recommendations and considerations to help focus on the immediate situation. It is essential to reopen the domestic economy as soon as possible, with the reopening of the external economy to follow as soon as feasible, given the economic conditions overseas. We are seeking to ensure that reopening is subject to established COVID-19 protocols. The government agencies and private sector stakeholders must commit to greater adherence and compliance to established safety safeguards and standards. Based on the Economic Recovery Committee's recommendations, we are preparing a strategy to approve all pending viable private sector and construction projects that are currently under consideration and to fast-track such approvals. The approval and execution of these projects will generate immediate employment and business opportunities for Bahamian contractors and trade professionals. The government is accelerating the execution of the budgeted public infrastructure and construction projects and will pay special attention to the smaller scale projects that benefit multiple small contractors. This will allow for increased employment in many vulnerable segments of the economy and benefit a number of Bahamian small firms. The government is also looking at ways to provide special support for the creative community and further support for Bahamian small businesses and entrepreneurs, to provide them with the resources and expertise to be able to showcase and deliver their products to the world. As I indicated above, I will give a national address to provide full details on the government's way forward concerning our economy. As with every country, there will be no quick fix to this grave global economic situation. But provided we all are prepared to move out of our collective comfort zone and undo the constraints that have too often defined us for decades, we can and we will shape a future Bahamian economy that is more dynamic, more resilient, more sustainable, and most of all, more inclusive. Street vendors play an important role in our economy. Accordingly, we will be offering a way for enterprising Bahamians to be able to sell their products on the streets of their respective islands and to be able to do so in a safe and sustained manner. The government will review the current licensing and regulatory procedures for street vendors. Our intention is to enable street vendors to be able to sell their products in safe and secure venues. We want them to be able to do so in a way that does not pose undue dangers to themselves, pedestrians, or the motoring public. We will put in place the standards that ensure that they are able to meet health code requirements and thus not pose any health risk to COVID-19 or otherwise. The vendors will be trained in these standards as a requirement of their license. We will make available additional funding to the Small Business Development Center for business grants for these street vendors that will allow them to adjust to the current circumstances and to support their business startups or expansion. To explain broadly, the street vendors that we have here in New Providence and throughout the Family Islands will be provided with financial grants, meaning that is money that they would not have to repay. That is gift from the government so that they can establish their business and expand their business. Example, the coconut vendors, or the coconut boys as they are called, the coconut vendors on the streets would be provided with the necessary materials and equipment to ensure safety of their coconut water. They'd be provided with coolers, umbrellas, and whatever items are necessary. And this would be provided as grants from the government. We must get our tourism sector up and running as safely and as rapidly as possible. Thus far, there is no economic sector as prepared to deliver the range of employment and the depth of tax revenues with great immediacy like tourism. Our task now is to restore our confidence in ourselves by shutting down community spread and flattening the COVID-19 curve of transmissions and infections once again over the next several weeks. The only way that we can get there is by moving from the government should to we should. It's not just the government, it's us. So let us move from the government should to we should. We have to move from they should to we should. We have to move from they say to we say. When the Bahamas is successful, it is not the government that is being successful, it is the Bahamian people who are achieving success. My fellow Bahamians, I again thank you for your patience, for your forbearance, for your fortitude, and for the many expressions of good wishes for me and my government over the past several months, and most of all, for your prayers. The demands and burdens placed on the shoulders of this young nation are unprecedented. That is why we so appreciate your submission of thousands of strong and considered recommendations for improvements. We will continue widespread consultation and dialogues with church leaders, with union leaders, including the medical unions, the nursing unions, with the Chamber of Commerce and Businesses, with civil society, and with others. Let me also thank my cabinet colleagues, permanent secretaries, heads of agencies and public service officers for their hard work and dedication to country. The preamble of our Constitution tells the world and reminds us that the people of this family of islands and this nation were born recognizing that the preservation of their freedom will be guaranteed by a national commitment to self-discipline, industry, loyalty, unity, and an abiding respect for Christian values and the rule of law. Self-discipline, industry, loyalty, unity, and an abiding respect for Christian values and the rule of law. In our Constitution, the first letter of each one of these virtues began with a capital letter to emphasize the depth and power that our national commitment to these elements will bring to the advancement and success of our Bahamas. We are not perfect, but in everything we do, as a proud sovereign nation, we must lean forward and upward toward a better and more perfect nation. When our history books are written in the future, the year 2020 will loom large. We wish to see it recorded that this gifted and beautiful blend of God-fearing people known as Bahamians, looked to the pledges made in our Constitution and addressed this pandemic with the same national commitment to self-discipline, industry, loyalty, unity, and an abiding respect for Christian values and the rule of law. That is our common challenge and our shared promise. Last week, 8-year-old Ethan Farquharson sent some encouraging words and a drawing to the government, which I want to share with the entire country. I say to Ethan, thank you. Thank you, Ethan, for the words of encouragement. Thank you to all of you who have offered your prayers, your frustrations, your suggestions, and most of all, your advice. We will get through this together. May God bless us all, and may God continue to bless the Commonwealth of the Bahamas. And along with the health team, I'll be happy to answer any questions that may be directed towards me. Dr. Regis.
Thank you. Krishna Virgil, do you have a question?
Good afternoon, Krishna Virgil Russell, the Tribune News Network. So last week we were made to believe that the situation, particularly in Nassau, was very, very serious. We had higher cases, and almost immediately the Prime Minister said, we have to go into lockdown. That was announced immediately. Of course it was reversed, but that was announced immediately. Now this week, we've gotten to a point where we have set a benchmark of August 31st of when businesses and the economy can start opening. Exactly what changed from then to now to warrant such a drastic turnaround in the way we were headed?
I'd like to, thank you. I would like to share with you the data that has been given to the government, and that might have informed their decision. 2 weeks ago, we had a very large number of cases. We also had a significant backlog. Within 2 weeks, what we were able to determine in terms from an epidemiological standpoint, that we had to be aggressive with identifying and informing the cases that were positive. There was an effort afoot to, as quickly as possible, not only inform the cases that they were positive, and there were a few hundred, but to also identify their contacts, recognizing that we could not do this with a paper-based system. We were ably assisted by so many, and the OPM's office, the unit of technology, to put in place an electronic platform to document what we were doing, to monitor the progress, and to revise the number of cases according to the backlog. This was a significant effort that required no fewer than 131 persons on a daily basis, Monday through, without stopping. And so we were able to present to the government an analysis of the cases. And there were a number of corrections, as you have heard. Based on those corrections that we have made, and again, ably assisted by so many, we were able to offer them where we were in terms of this wave of the pandemic. Unfortunately, we were only able to complete this in the last 48 hours, and definitely in the last 24 hours. And based on that, we offered a revised recommendation to the government. Next question.
Okay, my next question is actually I had a follow-up, but you all say no follow-ups allowed, but I'll still try. Take a stab anyway.
Sure.
I hear everything you say about the new data, but now we're also faced with a situation where hospital beds are full. We're hearing that a particular facility has a wait list for people with serious COVID symptoms. What does this say about the way forward?
That's an excellent observation. And we know that when we have peak cases, you have a lag between the requirements for hospitalizations, and you have a further lag with the documentation of deaths. I will refer to the Honorable Prime Minister, who has outlined a strategy for increasing the bed capacities, because we certainly need those bed capacities. And indeed, I would suggest that we also look at a management strategy that deals with this, because a lockdown would not necessarily change the requirements for hospitalization at this time. However, there is indeed a dire need for more bed space. Prime Minister.
Thank you very much, Dr. Dalridges. Yes, Crystal, we have a strategic plan moving forward in that we would move the borders out, thus clearing all of those spaces. The plan was to move the borders either at Poinciana Inn on Bernard Road, or identify existing private sector facility that care for individuals, and that would allow us these extra spaces within the hospital. And we've also identified spaces within the Breezes Hotel, and those non-COVID patients that are in the hospital, they would be moved to Breezes, thus freeing up the hospital itself, and we'd be able to establish a COVID ward within the hospital, and the non-COVID patients would be monitored at Breezes. And as the health team continue the excellent work they're doing, and as the contact tracers continue the excellent work they're doing, and as Bahamians increase their responsibility, I am certain that we would see each and every one of our Bahamian brothers and sisters wearing masks at the job site, open space, closed space, etc., construction. And once that is done, even with the assistance of the press, insisting that individuals should wear masks and follow all the mitigation protocols with respect to COVID, we would overcome this problem. But I don't want to expand too much at this particular time, Crystal, because over the next 10 days, the various given ministers will address the nation for at least 1 hour, so that the Minister of Education, the Minister of Health, the Finance Minister, the Minister of Tourism, and each of them would be able to address the nation in a press conference where you would be able to ask your question to the various ministers. And they will report to the nation as to where they were, where they are, and what provisions or what they are doing with respect to moving with the COVID. How are they planning to deal with the COVID that we're seeing today? So I would not want to preempt any of my ministers, knowing that over the next 10 days, we will have a very comprehensive report where each minister will report to the nation of their plan during this COVID era. What would they do to resolve the COVID situation that we face, and what would they do in terms of moving the economy forward? Thank you very much, Crystal.
Sorry, you weren't allowed a follow-up. Matthew Moxie, please.
Yes, good afternoon. So I just want to know, is there a mix-up going on in the Ministry of Health as it relates to its ability to deal with this health crisis? Some people have reached out to us and said that they have tested positive from private facilities, but have not yet gotten a call from the Ministry of Health. We've also had another gentleman call us just about 2 hours ago, alleging that he went to doctor's hospital to take a test, but never actually took the test because the line was too long. But he somehow got a call today alleging that he was positive but never took the test. So, is there a mix up going on? And how trustworthy are these numbers the Public Health Authority is reporting? I mean, just today, we saw the dashboard significantly be altered due to duplicate cases and perhaps for other reasons unveiled by the government. Will these numbers continue to alter causing more confusion that it already has?
The answer is yes. We are continually processing data. What we're finding out that with contact, I can speak to the contact tracing, and then I would come back to positive cases. The missing data or the gaps in the testing lab data is very challenging. We often have to find other means to identify working telephones. We are also challenged when we call and they're not ready for the call. They may be on a Zoom church meeting and tell us to call back. We are encountering quite a few challenges with the contact, and to overcome this, we are proposing a call center for contact tracing where we can invite the person who has been informed by the health team that they're positive, that they can call after the initial contact is made with the contact and the case, that they'd be able to communicate with the surveillance team. There's also other ideas that are being floated in terms of using an app for contact tracing. But at this time, we're trying to identify all the positive cases and their contacts. Now, with regards to the processing within the lab and the sharing of information with the surveillance unit, with the new labs coming on stream, we have put in place a protocol for transmission of information. However, you're absolutely right, there are concerns that each lab uses a different electronic platform. And these methods have to be reconciled if we're going to have timely information with regards to notification of a positive case to the affected person. But the first step that we are asking or recommending is digital entry of data at the time of swabbing. And when you have a lot of paper transmission, you have a lot of errors. And so that needs to be fixed. You have another question?
Yes, there have previously been a lot of rumors floating around about influential figures being in town and talks about vaccinations. Once there is one, this is a question for the Prime Minister as well. Will vaccines be mandatory for residents? If not residents, will they be mandatory for students in schools and other sorts of things like that?
He says, I'm sorry. You wish me to? I shall. Not a problem. Yeah. Vaccines. This has been my area of work for the last 30 years. And when you have new vaccines, they must be pre-qualified and meet all GM standards. There's 7 stages that vaccines must go through before they can be approved. Once approved by the National Regulatory Authority, that could be in India, Indonesia, the UK. We have had not so good outcomes with the USSR and Vietnam globally. However, once they are approved by the National Regulatory Authority in that country, and that is done by a team of scientists led by an international group, we then seek the recommendation of the unit at WHO that gives guidance to the availability of this vaccine. They have the manufacturers would then contract with the various large organizations to manage these vaccines. We have historically been the beneficiary of the revolving fund for vaccines, where we receive the vaccines and then we have the opportunity to look at the delivery methods of the vaccine. A vaccine is a biological, but the delivery method, be it injection, be it by sugar droplets, all that has to be sorted out. And then you make application to get that vaccine. But if we have the access of that vaccine through our current channels, we can be guaranteed safety of the vaccine. So I would submit to you that once the country is satisfied that the vaccine is safe, affordable, and accessible, noting that the management of adverse events following vaccines, all that criteria have been taken care of, there is no reason why we shouldn't be in line to receive those vaccines. Elizabeth Bryan.
Yes, good afternoon, Bahamas. Prime Minister Minis, Dr. Dal Regis, and the other health officials. Mrs. Elizabeth Bryan here from the Lutheran newspaper. I do have a question. There's now a category on the Ministry of Health dashboard for non-COVID related deaths. So I'd like to ask, in the case of actual COVID deaths, are you seeing any deviation from the previously stated trend of deaths being strongly related to comorbidities in patients? Dr. Regis.
Sure. Do you mind if I refer to the active clinicians who are here? I can give you the data on the area I'm currently working is contact tracing, but I'd like to refer that to Dr. Macmillan, the Chief Medical Officer, who has reviewed that data. Dr. Macmillan.
Good afternoon. Certainly as it relates to comorbidities and COVID-19, in the first wave, we would have reviewed, which comorbidities each of our COVID-19 deaths had. And we did find that persons with comorbidities such as hypertension, diabetes, obesity, we had a higher percentage of those persons who were actually hospitalized, and certainly deaths were higher in that grouping. We have not done that assessment as yet for second wave, but certainly we are beginning to look at the deaths that we have to determine exactly whether or not that is indeed the case in our second wave.
Mr. Olson, we have Dr. Forbes, I understand, who's actively working on in the clinical institutions. Can I invite her to respond to you as well? Dr. Forbes, are you available?
Yes, Dr. Del Regis, I'm here. remotely via Zoom.
Mhm.
Good afternoon, everyone. Thank you very much for the question. I can report that what we're seeing on the front line on a case-by-case basis is those persons who are not doing well with COVID-19 who are indeed passing away have a number of comorbidities, including hypertension, diabetes, obesity, connective tissue diseases, and sleep apnea in many cases. So we know that that compounds and worsens the clinical outcome for these patients. We'll follow further as we gather information on the second wave based upon how many comorbidities these patients have. Thank you.
Thank you, Dr. Forbes. Elizabeth Bryan, do you have a second question?
Yes, thank you, Dr. Regis. Okay, concerns have been shared that information some deem to be pertinent, such as age, gender, and township location, is not currently being shared about active cases and deaths in Eleuthera, causing unnecessary panic and possibly a lack of cautionary discipline by some in the public. Can you provide clarity on the reported death in Eleuthera? Was this a person who was diagnosed, admitted to hospital, and died? Or did this person die while in Eleuthera and was diagnosed post-mortem? And are there proper protocols in place to identify and test people showing symptoms on the island?
Mr. Bartlett would answer your question.
Good afternoon, Bahamas. Ms. Bryant. That death, the one death that happened in Eleuthera, and we do give condolences to the family. That was a young 45-year-old male in the central southern area. He died, and then he was swabbed posthumously, and then the test result would have come back positive. Protocols in place now is that anybody that shows or touch base with the healthcare team that are showing signs and symptoms of COVID-19, they are swabbed, isolated, and then contact tracing is immediately established. Thank you.
Karen Bain, please. Hello.
Good afternoon, Dr. Del Regis. Good afternoon, Bahamas. Karen Ferguson Bain, Global 99.5 FM. The recovery rate is very slow as far as numbers of the Bahamas. Can we get an update as to why the recovery rate is going so slow for us in recovered cases?
Thank you. Should we show that the slide? I'm not too sure you're referring to the slide of today, because we have significant recovery rates. And your observation is a good one in that we too asked about the recovery rate when we saw the low numbers. But once we got the data into an electronic database, we were able to see the recovered cases a whole lot better, and we're now even higher than that. We update this on a daily basis, and today's date is 600 and plus. But we're getting there. And we also try to call each of the cases to be sure that they're doing well and meet the criteria for recovery, which has just recently been revised by WHO, by the way. Next question.
Yes, ma'am. Persons are also concerned about testing. Is the government offering free testing, and where can we find facilities for testing on the islands of the Bahamas, especially those who have COVID-19 persons infected?
I strongly suggest that you contact your public healthcare facility in Grand Bahama or wherever, and they would offer you triage. As I've said to you, that it's all right to test, but you must get your result in a timely manner, and you must meet the criteria for testing. Ralston Jones, please.
Good afternoon. Has a decision been made on whether the government will have to defer the salaries of some public servants, namely Bahamas Air, which the Prime Minister had foreshadowed, I believe, in late July, that would occur, or that was being considered by the government with the compulsory bond offer. Could the Prime Minister perhaps speak to whether that has been necessary or determination has been made on that, and whether it expands to other civil servants?
Thank you very much, Royston. First and foremost, I would have said repeatedly that I do not believe in laying off individuals. And the reasons are straightforward. When you lay off an individual, you destroy their dignity. And at the same time, that individual, if they were making an allowance of $300-400 per week, and they had a household of 5, 6, and I can talk even from experience, I don't know how they're able to support and make ends meet with that small amount of money with the 6 or 7 individuals. But when you lay them off, they must now become a ward of the state. They then go to social service. And those 6 or 7 individuals have great stress and problems. And so all you're doing is moving from one end of the spectrum to the other. So as to your question with respect to Bahamas Air, we would have had discussions, but no decisions have been made. Those would have to be matters. We're trying to open our economy, get individuals working, opening our borders. And once our results continue to move in the direction that they are as a result of the excellent health team we have, and if you and others would assist in getting the message out to individuals that they must be compliant in wearing their face mask, we would be able to get over this pandemic that we're seeing as quickly as possible so that individuals can get back to work. And if those in the other part of the world have excellent results also, then we can get our tourism engine running, which accounts for about 80% of our employment, be it direct or indirect. So we would be moving very as efficiently and expeditiously as possible to get our economy rolling, rocking and rolling, and have individuals going back to work and have our airlines flying and our tourists coming back into our country. If you look at the graph that was provided by the health officials, when we opened our borders, if you look at the graph and the data speaks for itself, less than 1% of the infection that we see today is as a result of our visitors, our guests who came into the country. All of our infections were as a result of us, the Bahamians, who went into hotspots and subsequently brought it back. So if we could have controlled that portion ourselves, if we were responsible enough to control ourselves, then our economy would have been, like the young people say, rocking and rolling. Thank you very much, Royston.
Do you have another question?
Thank you, Prime Minister, and hopefully we'll see a date for reopening very soon. The second question concerns press conferences. This breakdown and analysis of trends amid the second wave, which is exponentially seeing more cases, arms the public with necessary information. The first wave, which had 104 cases, we saw far more press conferences with Ministry of Health officials exchange this sort of information with the public than in comparison to the second wave, where there are infinitely more cases. Does this speak to perhaps the healthcare officials being overwhelmed, including the surveillance unit? And why are we not seeing as much exchange of information to the public via these sorts of forums than we saw in the first wave, when the need for it is much greater with more cases and more deaths?
Interesting. I think we have to be brutally honest here. We have to have the appropriate resources to meet the needs. We're getting there, but we're not there yet. And we have made significant strides in doing so. and you will be seeing more data in a more frequent manner. Carl Joaquin, please.
Hi. Can you hear me?
I'm listening.
Okay, great. This question is for Dr. Minnis. Dr. Minnis, I know you said you were going based off of the medical advice, but did the pushback from Bahamians, including the business community, spark this, I guess, about face with a kind of a slow reopening? And do you have any regrets with how some aspects were handled?
Well, first, to answer your first question, Kyle, thanks for the question. But to answer your first question, I think Dr. Dalrigis had answered that, presenting all the data yesterday and today. So that question was answered. As to answer your second question, whether I had regrets, I think what you're asking is whether, and you can correct me if I'm wrong, this is just my interpretation of your question. Are you asking whether I have regrets in terms of making the announcement that the lockdown is immediate? Is that your question? I'm listening.
Yes, sir.
That was your question?
Yes, sir. Basically.
Right. Okay, what happened is the data would have suggested at that time that there should be a lockdown. We would have had, our main concern would be to save lives and safety of Bahamian populace. The data showed that in the month of August, there was a 195% increase in the number of COVID positive cases. It also would have shown that there was a 107% increase in the number of deaths. And it also would have shown that in August, there would have been a 337% increase in hospitalization. All of that is concerning. We would have also had evidence and experience that on April 3rd, I believe, at 5 p.m., I had made an announcement that at 8 p.m. the same evening, meaning immediately, we were going into a lockdown or a curfew immediately. That was on, and you can check your records, that was on April 3rd at 5 p.m. that was announced. The following morning, I would have experienced similar backlash like I've had recently. But my concern would have been first and foremost lives. Then we were faced with another situation. Individuals were stating that they had not been given sufficient warning, there were no notice, no preparations, etc. And I would have been called everything except a child of God. Then we had a similar situation, and the decision was made to lock down Grand Bahama. And therefore, because of the first experience with the immediate, we decided to give the appropriate notice. We gave the appropriate notice, and the data, if you were watching and looking at the graphs, the data clearly shows that as a result of the mass migration from Grand Bahama, Abaco would have been infected, Baker's Bay would have been infected, Moores Island, and the data is there, Moores Island would have been infected, the Bimini's would have been exploded, the Berries would have been exploded, and New Providence would have had a second impact, not only from the travel to the northern hemisphere, but the travel of these individuals into New Providence. And New Providence would have gotten two blows. And therefore, recognizing what had happened, was always my intention to prevent such migration and to protect the Family Islands. It was essential to protect the family islands because they are older residents and they do not have the infrastructure in healthcare facilities as we do in New Providence. And if you are a scholar of history and wars, you would note that it's always better to fight a battle in one place as opposed to 6 or 7. If you were to confine your enemy to one location, you can win that war. But if your enemy spreads out to 6 or 7 areas, you are now fighting 6 or 7 battlefronts. The determination was made that it's always safer to fight in one battlefront and protect the family islands. It was felt that, and this was great debates between ourselves, it was felt that if warning or notice were given, then there would be mass migration to the family islands by boats, even though we would have taken the necessary precaution to try and minimize it. Hence, Auckland would have become infected and Crooked Island. Auckland and Crooked Island have still been infected, but let's look at the history. A lockdown or inter-island transportation was being stopped on the 28th of June, I believe, or 28th of July, my apology, on the 28th of July. Hours before that order came in. That order came in to effect at 7 p.m. to stop inter-island flights. Hours before that order came in, and even up to the day before, 157 people left New Providence on a charter flight, subsequently traveled to Auckland and spread the virus. That is how Auckland and Crooked Island became infected. 157 people, and I call it totally irresponsible, knowing that your borders, your inter-island flights were being canceled in a matter of hours, you subsequently. The members from Auckland, the residents of Auckland, called me very concerned and disturbed, informing me that about 157 individuals, they couldn't say the exact number, but they said over 100, but I can give you the exact number, 157. They said over 100 individuals entered their shores for a homecoming event. My exact words to them, they called me, my exact words to them was to stay away from them as much as possible, because I do not know whether they are transporting the virus with them, but there is that possibility. And if you came in contact with them, your island will be infected. Residents of Crooked Island called me on the same day, Tuesday the 28th, and said they were concerned because so many people had entered their islands, and those individuals may possibly come over to Crooked Island and subsequently affect their island. The rest is history. That is how Auckland became infected. That's how Crooked Island became infected. And I'm advised that individuals are trying to run from those given islands to Mayaguana. And if that happens, Mayaguana will subsequently become infected. So I was thinking first and foremost of saving lives. And I was thinking first and foremost of protecting the family islands, because I know they have comorbidities. That's an elderly population. And as the Prime Minister, it's my responsibility to protect all. If our resources were centralized here in New Providence, and our battle with the COVID is centralized in New Providence, then our family islands would have been protected. Thank you very much, Kyle. I just want to expand on one thing, Kyle, before I leave. I forgot. What I want to say is that information would have come to us afterward that there were numerous boats already prepared with the relevant material, fuel, etc., ready to leave and head to the Family Islands. They were on their way to Long Island and others. And that was why such decision was made, to protect Long Island, to protect Inagua, Mayaguana, and fortunately, a responsibility on individuals affected Acklands and Crooked Island. But we wanted to protect San Salvador and the rest, the entire Family Islands.
Kyle Joaquin, you have another question.
Yes, ma'am. Thank you. This is for the health officials. How are we looking, because of the increasing number of hospitalizations and deaths, how are we looking with ventilators? Are we maxed out? How many do we have? How many are in use?
I'd like to invite our inventory control manager to respond to you. Ms. Mary Walker, please.
Good afternoon. Thank you for your question. When we started this battle, we started with approximately 60 ventilators that were functioning. We increased that number by an additional 6, and it spread over both New Providence and Grand Bahama. And we are currently at that functional level of 66 ventilators, with 10 being repaired currently.
Tyler Simonet, please.
Yes, good afternoon, all, and good afternoon to the Bahamas. My first question is for Dr. Forbes, if she's still available. During the last press conference, Dr. Forbes mentioned that reinfection is not really a concern for the fight against COVID. But this morning, Hong Kong recorded the world's first case of reinfection. A 33-year-old male was reinfected with COVID-19 4 months after his first infection. From the medical perspective, what does this mean for the fight against COVID now that it's possible? It seems that it's possible for people to now be reinfected with COVID. And could you explain how this happened?
Dr. Forbes, are you able to respond?
I am.
Okay.
Good afternoon. Thank you, Ms. Simonet. Yes, I read that report today, too. Very unfortunate, daunting news for us in the medical community. When you have a new outbreak virus, you learn more and more about it every day. Before today's report, we had reason to think that immunity from COVID-19 would last for some period of time based on our previous experiences with viruses like this, the MERS-CoV and the first SARS, and we knew immunity could last for 6 months or maybe longer, and there had been no reports that anyone had been reinfected. As a matter of fact, late last week, there was additional information in the scientific community that in addition to the antibody response, we might hope that certain white blood cells that fight infections called T cells could give a longer immunity against COVID-19. Unfortunately, today we did get that report that a male patient had COVID-19 earlier in March and that he traveled to Spain and that he did get COVID-19 again with a different strain. That means that you could be reinfected with COVID-19 and that immunity may not last. And it is challenging when we think about that. What does it mean now in terms of the possibility of reinfections or lasting immunity? He is the first case reported today. We will wait and hear more, but definitely daunting, not good based upon what we've heard. Thank you.
Thank you, Tyler. And we have to be very, I'm happy that you're keeping up with the literature because vaccines and the immunity, the protection from vaccines also plays into this. And when we have the opportunity to choose a vaccine, we have to look at how long the protection lasts for. A very good question. Tyler, do you have another question?
Yes, I do. And thank you for that response, Dr. Forbes. My second question is for the Prime Minister. Um, why is it that back in May, you accepted the former Minister of Health's resignation letter in the middle of a pandemic as he took responsibility for the 6 American residents that breached protocol when they entered the country? But when the Minister of Tourism openly admitted to approving the wedding that happened on Harbor Island, he merely said, and I quote, "I guess maybe we failed and I apologize for that." Can you explain why these two situations where it appears that a minister who made a mistake had such severely different outcomes? What was so different about these situations that one would cause the resignation of the Minister of Health and the other only offers a small apology to the Bahamian public?
Thank you very much. That's a matter that has been dealt with extensively in the press, and I would not go down that road today. Today, we are more concerned with dealing with COVID, saving lives, saving the Bahamian population, our health structure, and getting our economy reopened and creating jobs so that people can get back to their lives. Thank you very much.
Sasha Libran, please.
Good afternoon, Bahamas. Good afternoon, Dr. Dal Regis and all the other officials gathered, including Prime Minister Hubert Minnis. Dr. Dal Regis, my first question is for you. When you initially came on and started to break down the numbers, you said that there were 2 additional deaths. And then you went on to say that we have 46 deaths. Now, between Saturday's dashboard, which was released early Sunday morning, and today, it seems as if we have increased indeed by 17. Can you explain those numbers? The last number that we had received from Bahamas Information Services indicated that we had 29 deaths, and now we're saying that we have 46 deaths. So can you just go a little bit further into explaining the jump in those numbers?
Yes. Do you mind if I ask the CMO to address that? She's been working with those numbers for the last 48 hours. Dr. McMillan?
Thank you for your question. Certainly, we anticipated that there will be a query around the increase, and that relates to us actually incorporating what we would call deaths under investigation into our dashboard. Before that, what we did was just report those deaths that were, straight out COVID deaths, or we were able to determine at the time of death that, this death was actually caused by COVID-19. And we had the non-COVID related deaths that you would see just under that number on the dashboard. But we made the decision to begin to incorporate a total number of deaths, which includes those deaths that we are actually reviewing to determine whether or not there will be a COVID-related death or a non-COVID related death. So that is what resulted in what seems precipitous increase in the number of deaths on our dashboard. So we are at 46 plus the 5 that we have that are non-COVID related deaths. Thank you.
Do you have another question?
Yes, I do, Dr. Dal Regis, and thank you, CMO. This question is for the Prime Minister. Prime Minister, I know that you've already announced to us that respective ministers will give us an update. Considering that Monday, however, is the last day of August and we're heading back into what we would deem as the school year or the academic year, I know a lot of parents have reached out to us with respect to an announcement made during the budget with respect to VAT-free items locally to encourage domestic spending here on school supplies. How soon will we see that implemented, especially for things like laptops? Maybe more people need laptops now, maybe routers, that sort of thing, books, pencils. I know Kelly is particularly put out a school sale list today. Could you just speak to that, considering that, August 31st is right here and a lot of schools will be opening, and some have already actually had teachers start back today. So can you just address that really quickly, especially for those parents who want to know whether they should go on Amazon or whether they should wait for the government to release or say whether this is indeed going to happen?
Thank you very much, Sasha. The Ministry of Education, led by the Honorable Jeffrey Lloyd, would be first, as you would say, first out of the gates, because we know that school parents would be making preparation for their school, for their kids. And therefore, I would not want to preempt the minister. The minister would give a comprehensive outline as to what will happen in terms of reopening the school, how they would deal with individuals who may have access to computers, individuals who may not. He has strategic plans, and I think it would be unfair for me at this time to preempt the minister, knowing that the minister will address the nation on Monday, giving a comprehensive report of the back-to-school program and the rolling out, however it will be done.
Altavis Munnings.
Good afternoon, Dr. Del Regis. Good afternoon, Prime Minister. Good afternoon, Bahamas. Dr. Del Regis, my first question is for you. Can you say whether or not asymptomatic residents pose a challenge in health officials researching the COVID-19 pandemic here?
Yes. And if you want more details, we can ask the ID specialist to speak to it.
Yes, please.
Dr. Forbes.
Yes, good. Yes, good afternoon. I'm happy to speak to that. So we do understand that asymptomatic individuals can indeed transmit COVID-19 to other persons. What is the magnitude of this problem? It's very hard to say. Let me try and explain. People who are asymptomatic, they may not come forward to get a test. So it's hard to know exactly how many people are asymptomatic in a general testing strategy when you have an outbreak. You would not be sampling the whole population. Of course, it's not feasible to do so. I mean, look at the population of the Bahamas, 400,000 people. You're not going to test them all in one sweeping testing exercise and find out what proportion are asymptomatic. Our information when it comes down to just how many persons may be asymptomatic generally come from other contexts. Last week on a show, I explained, for example, there was a cruise that left from South America to go to Antarctica. Everyone had been tested before they got on board, but unfortunately, there was still a COVID outbreak on the ship, necessitating everybody to be tested. They found that almost 40% of people were asymptomatic and tested positive for SARS-CoV. That gives us a bit of an idea that up to 40% of people in an outbreak may be infected with COVID-19 or have COVID-19 and be so-called asymptomatic persons. That is difficult because we know that this impacts transmission dynamics in outbreaks and in countries. Hence our general public health recommendations, masks, social distancing, avoiding crowds and close contact, because we know the weight of the fact that there can be asymptomatic transmission. Thank you very much.
Okay. Do you have a second question?
Yes, ma'am. And Dr. Forbes, thank you so much for that answer. Dr. Del Regis, I know that a lot of Bahamians like to use natural elements like bush medicine, fever grass, lemon, ginger, and I understand that a lot of them are now using that to, say, cure their COVID-19 diagnosis, although a vaccine has not been created as yet. Do health officials support this move?
Can I refer that to the science of the alternative medicine group? Dr. Forbes? If not, I would take it if you don't.
I'm happy to take it. Sorry, it takes a
Okay.
while to unmute and turn on the video. So it's a good question, and it keeps arising in terms of treatments for COVID-19, both traditional and herbal therapies. So I would hasten to say that when we consider treatment, we think of best quality scientific information and literature that such therapeutics will work. So to date, there has been no evidence that there are any herbal remedies that will cure COVID-19. They, in fact, some of them can be dangerous, and I would encourage persons to follow the best quality medical information from trained medical specialists. Our guidance is based on best quality information and expert guidelines, consensus, and review of the available literature. There's no herbal remedy that's known to treat COVID-19 at this time.
Thank you. Jasper Ward. Madame. Are you there? Jasper, are you there? Can I then go to Samarco Lightburn, please?
Hi, good afternoon. Samarco Lightborn from the Blaze 98.3 FM in Exuma. Is geomapping available to all family islands that currently have infected cases? And if not, in lieu of that, do the respective police stations have a listing of persons who should be in quarantine? One of the main challenges has been the fact that some of these persons are still roaming freely against medical advice.
Says yes, and they should be part of the health team, and communications are shared with the police for enforcement purposes. We're also hoping that we can apply the geofencing for all family islands where there are cases. Next question, please.
Thank you. And my second question, perhaps for Dr. Forbes, but I'm sure you'll be able to direct me. There has been studies and research into convalescent plasma, the plasma which contains antibodies to the virus. Have we looked into that as a possible course of treatment?
Dr. Forbes.
I'm here. Thank
Okay.
you. So that's very interesting. Convalescent plasma has been used for over 100 years to treat certain medical conditions based on the fact that there could be antibodies in the plasma that could be helpful. It's convalescent. It's from someone who's had COVID-19 and has gotten over COVID-19. Based on the Infectious Disease Society of America recommendations for the treatment of COVID-19, it is still a research modality, means of treatment. It can be used in compassionate use for the sickest patients. We have looked at and explored that, and we have given it on a compassionate use basis, but it is still not standard of care.
Dr. Forbes, would you speak to this morning's news news alert that it's really not showing the promise that it did? Over.
Absolutely. So we know that when we talk about compassionate use, I'm talking about for the sickest patients, where we're going to weigh things like the risk versus the benefit. So when we think about convalescent plasma, the numbers of people involved in those studies were very, very small, and the mortality was still relatively high. So when we say, what is the context of something like that? The person would have to be very, very ill, and we would have to weigh that the benefit of such a thing may be small and marginal, and the risk is perhaps insignificant, that it's worth taking a chance. It is not standard of care at this time. We wait for the rest of the research and the findings to come in.
Thank you. I think that Jasper Ward has returned. Madam Jasper Ward, are you there?
Dr. Dalregis, can you hear me?
I can.
Welcome back.
I'm not back.
Well, welcome, nevertheless. My first question is for the Prime Minister. Has there been any changes as it relates to inter-island travel?
Yeah, thank you very much for your question, Jasper. No inter-island travel there has been no changes, and in fact, if one want to travel to Family Islands, they would receive clearance by the Director of Civil Aviation. They would apply, and obviously of special circumstances and their requirement to travel to that particular Family Island, especially if it's a sterile Family Island, and there'd be a requirement to fly back to New Providence.
Thank you. My second question is for the health officials. Can you indicate how many health workers have gotten COVID-19 since July?
72.
72. Can you indicate how many have been exposed?
Yes, we have a nice slide for you. I don't know if we can show that. They're from different institutions, as you would have imagined, exposed, and we apply a risk tool to evaluate the extent of exposure. So we have affected those who are COVID positive and those who have been exposed, and the number is 72. But if we're not able to show that slide, I could make that available to you. Thank you so very much for all of your questions. That concludes today's press conference.